In a moment. All right, we'll be joined by Dr. Rex Mpanze, who is the team lead, Emergency Preparedness and Response Cluster for the World Health Organization in Nigeria. So he's going to be joining us to take a look at some concerns that have been raised about COVID. So, well, I guess he'll join us in a bit.
One of the things that I'm really looking forward, a number of issues have been raised as far as COVID-19 is concerned, in our part of the world. First, I remember, I won't forget, the question you asked the DG of the of NAFDAC at the time, what are our low-hanging fruits? And I won't forget that answer because it is still the way to go. Everyone else has, especially those in the research and pharmaceutical, space, have hinted at the need for Africa to go into phytomedicine, which is its strength. And that's talking about herbal medicine and all of that. That's what the NAFDAC DG mentioned. We also hosted the DG of NIPRID who said the same thing, the need for us to consider homegrown vaccine solutions. The question is, how far so far? A good number have also said, look, if we're going to solve this problem, a lot of funding is needed. For research in particular, question then is, how far so far?
Especially when you know that that's the pharmaceutical end to winning this battle. But there's also the non-pharmaceutical interventions, the very simple ones. It will seem the wear your face mask, maintain physical distance, wash your hands, keep your hands clean, especially at all times. So
you smiled when you said wash your hands.
It reminds me of Mr. and Mrs. this morning. It's hard to get that off my mind. But the point is, we need to bring all of this together if we're going to prevent a third wave in the country, especially because, with the projections we're having, it looks like it might be more likely.
Yeah, so, well, I guess we'll just hang on until Dr. Rex joins us now. All right, so we do have Dr. Rex Mpanze now. Good morning, and thank you for joining us today on the program. Well, looking at some of those information out there, it raises a lot of concerns. But tell us, from what you've seen out there, how real is this threat of a third wave of COVID in not just Africa, even in Nigeria?
Good morning, and thank you for having me on this program. The threat of third wave is actually real, and we can see some manifestation of it already in some countries in this region in Africa. There are a number of countries in Southern Africa and East Africa that have already started to see what looks like a third wave starting to manifest. As we all know, the waves, from the information now we have that we are more than a year in this epidemic, are seeming to be coming every 6 months. So obviously for Nigeria, we had our wave at the beginning of this year, which peaked around January, February. We expect about a 6-month period of that really to have another wave. And if you have also seen the trends, the waves are to a large extent driven by people not really following the non-pharmaceutical interventions. And it always seems to come at the height of that behavior when people have really completely relapsed and are not at all following the non-pharmaceutical interventions. And secondly, it always seems to come when there's a new variant. So even when we look at in Nigeria, between the first wave and second wave, we can see that the predominant variant were slightly different. So the variants can either emerge within the population or they are imported. So we expect that indeed, because the threat of importation of a new, more virulent variant, or indeed an emergence of a variant locally, still persists, and these risks are real. And the only modification to this risk that should have happened, but we haven't been able to because of shortage of supply of vaccines, is really to vaccinate the rest of the population. So the risks, unfortunately, in terms of the third wave, exist in Nigeria and exist in many countries in Africa, and therefore it is almost inevitable that we will have a third wave. So that's really a response to your question, I believe. time.
But what kind of impact would you say vaccinating high-risk populations will have on this threat? Because many nations, even in Africa, will say, well, we've done that to a large extent.
Yeah, as of now, for example, we take the example of Nigeria. The vaccination coverage that we have achieved with what we have done so far is only 0.8% of the population. And that is not going to have a dent on reducing the risk in terms of third wave. As you have heard multiple times, we will need to vaccinate in the regions of 60 to 70% of the population in order to now have a reduced risk. As you have seen in many interviews, it is clear that when people are vaccinated, one, it reduces the chance of acquisition of the virus. We don't know by how much, but significantly, we know for sure that it reduces also morbidity and death in terms of ill health. So definitely vaccination is the answer that we have to look to of making sure that we don't continue to have wave after wave, and we can have really a longer period of time without problems. I should caution, though, that vaccination is not in other words, the panacea, in the sense that if you are vaccinated and somehow, some way, a strain emerges that doesn't respect that vaccine, then you can still see another wave coming. And this is a threat that the Western world, who have gone ahead and done quite a lot of the vaccination, that really they are minding quite a lot, because although they have vaccinated their populations, the risk of a variant being introduced that may not respect that vaccination may come, and that may require that a new vaccine entirely is administered to the population. But definitely, even with that, we see that the main answer to this epidemic eventually is vaccination, of course, combined with the other interventions that we're already doing. Thank you, Andova.
Yeah, so if we could just paint a picture, maybe, what a third wave might look like. We've seen the first wave, we've seen a second wave, but with the projections, what can this third wave look like in terms of the cases? Will it be remarkably higher than what we saw during the second wave, or with the vaccinations we're seeing, it might be tapered down a bit? What do you foresee?
So there are many factors that will determine really what the third wave will look like. The first and probably the most predominant factor is the variant that predominates in the third wave. If you have a more virulent transmissible virus, as the case has been in terms of driving the two subsequent waves, is that we will eventually see a higher caseload, because there will be more transmission, and eventually, really, as we have seen in other countries, probably higher fatality and also morbidity. But also, as I said, there are other factors, and these are factors in terms of what we do now to forestall the third wave, or to prevent it, or to mitigate it. So if we are successful in doing the mitigation measures, for example, making sure that we have repositioned all the required capacities to deal with the third wave, we can forestall it quite quickly in terms of making sure that it won't go on for a long time. As of now, I think the average period that a wave has lasted is about 3 to 4 months. So we can forestall it quicker. There have been countries that have stalled a wave in less than 3 to 4 months. So, but that depends on how prepared you are towards that third wave, and also the preventive measures that are in place. So depending on really all the combination of this, the virulence of the virus that will drive the third wave, and then the mitigation measures of prevention, preparedness, as well as other measures, we can reduce the impact of the third wave and make sure that it doesn't become as high as the previous waves, or more devastating than the previous waves. Thank you.
Right, so have we been able to get an answer to the question around why Nigeria, even with a population of 200 million, didn't record as much cases and fatalities as first were projected? I mean, I recall earlier on during the pandemic, there were projections about what will happen to Nigeria. I mean, talk about bodies on the streets, the health system being overwhelmed, Nigeria really being battered by the virus. But I mean, it's over a year now since the pandemic, and we've not really seen those projections coming to life, thankfully. But more importantly, scientifically, have we been able to answer that question as to why those projections didn't happen, why Nigeria... If you look at Africa, for example, Nigeria with 200 million has not recorded as much cases or as much deaths related to COVID like other countries. So has there been any answer to that?
Yes, there are pointers to that answer. There's no definitive answer so far, but definitely there are quite clear pointers in terms of why that has been the case. First and foremost, really is that Nigeria, like many other African countries, have really not gotten the infection in terms of transmission at the rate that other European or other Asian countries have seen so far. Either because of the way our economy is set up. As you know, in Africa, majority of our economy is outdoors. And unlike in Europe and others where the economy is indoors, which are really are conditions that perpetuate the spread of the virus. And we also know that there may be some inherent immunity possibly in Africa because we do suffer other diseases that have to do with coronaviruses, including diarrhea, and there may be those elements. So those have been looked at. But foremost, what I can mention also is compare Nigeria to other African countries. Nigeria has done extremely well. And that, if you compare that, really is as a result of the leadership and the kind of response that Nigeria has done as compared to other African countries. I think in Nigeria, if you look back, Nigeria was more preemptive to its actions. Even as of now, if we look at the sort of restrictions that Nigeria has applied, whether it's in terms of travelers and all that, Nigeria is a little bit more preemptive compared to other African countries, and therefore it has managed and successfully so to forestall, for example, importation of a more virulent variant so far, and as well as really successfully make sure that waves are contained in record time, and as you have rightly mentioned, successfully managed to have a case fatality ratio that is the lowest in the region. So Nigeria has really done quite well in terms of the response, I think, thanks to the leadership and thanks also to the resources that the government and partners did put in place to make sure that this is possible. So all those are the possible reasons we can mention, but there's no one definitive one. And that's why, as we are preparing with the third wave, it's really to try to appeal to the leadership and try to encourage the leadership to put the same zeal as they have done for the first and the second wave, and the resources and preparedness and capacities at all levels to make sure that Nigeria continues to shine in terms of how really the country has managed to contain the previous waves.
You hinted at inherent immunity in Africans. Any idea where that came from? Is it just natural? Is in the nutrition, which some have said it's probably in the things Africans eat in our diets and all of that? What's the origin of that, the inherent immunity you referenced scientifically?
Yeah, what is in the literature, what they are pointing out, which is not definitive, is obviously that in Africa, causes of diarrhea, diseases that we suffer in childhood, is the coronavirus. So there is a pointer that probably that may confer some level of immunity to coronaviruses in Africa. So there are also other pointers that have been made in literature in terms of the possibility of immunity, in terms of cross-immunity with other diseases, but that's the most definitive one in terms of the possibility that there may be some level of immunity in Africa because of that coronavirus.
Okay, so if that is the case, is there any way to, reproduce or whatever it is to help Africans get locally made vaccines, since they already have a measure of immunity, just as you have said, owing to many decades of experience with what you have talked about? is there a way to multiply that immunity, whatever it is, I don't know what scientists call it, to create locally made vaccines? Because many have said that that perhaps might be a way to go for Africa, given that all other countries where these vaccines are made are having it worse.
Yeah, the answer to that is that really the way to go is to make sure that we vaccinate our African populations with the vaccines that are now present and which are quite effective. And in fact, it's possible that in Africa they may be even more effective because they will ride on a level of immunity that already exists. So it's really to use the current vaccines that are available. Thinking of Africa synthesizing only vaccine and then coming up with only vaccine in the longer term, that really will not help us with this epidemic, since we already have the epidemic. But in the future, yes, because as W.H.O has always indicated that the risk of outbreaks with coronaviruses in particular and other types of virus will continue even when we contain the COVID-19. So definitely in the future, Africa needs to strategize to look at how to build on immunity in various areas, including those future possible coronaviruses. But for now, the answer really is to get hold of the vaccines that have so far been produced and make sure that we vaccinate majority of our African population and indeed boost their immunity so that Africa remains, as we have seen, that it has not been as affected as previously predicted.
How about phytomedicine? Because I know that the Africa CDC has been talking about that, trying to create a system around it. And the World Health Organization is also looking at some form of partnership to fast-track that. So what's the vision? What's the hope? What's the process about developing phytomedicines that can work in Africa, especially for this pandemic that we're battling now?
So as we know, I think to start with is that for the current outbreak of COVID-19, it really doesn't have a definitive proven treatment. The treatments that are being used currently are supportive. And therefore, at the global level, there is an accelerator initiative that with partners has launched to really try to find more medicines, definitive and supportive medicines. And that initiative is going on. And in fact, the issue of corona vaccine is one of the products of that initiative of really trying to find effective medicines. And quite a number of African countries are partnering with W.H.O in that. And we know Nigeria is also partnering in a number of areas. And there have been discussion recently even for Nigeria to be looking inward on local manufacturing of medicines as well as vaccines. So this is a conversation I think that has come and has started with this outbreak, but it's probably not likely that we will be able to produce a viable medicines or indeed vaccines within the outbreak. So in as much as at the time being we need to source whatever is available, indeed that initiative needs to be strengthened so that in the long run, indeed Africa is able to produce the medicines, either supportive or definitive medicines and the vaccines to deal with future pandemics and indeed the infectious diseases that Africa is still dealing with.
Well, talking about future pandemics and the likes that may happen and hopefully not, but then it seems like from specialists like you have spoken to us about the possibility of these things. But many always talk about the challenge of funding for research to prepare for such eventualities that we hope will not happen, but could happen. And if it does, we should be well ahead of it. So rather than responding, the way we always have to respond, emergency and all of that, is there a way, how do we deal with the challenge of funding for medical research in a way that Africa, Nigeria can stand alone and be able to get ahead of these issues before they become serious?
That's, I think, the fundamental question that we will need to keep on asking and try to find a more appropriate answer. And I'm aware, for example, in Nigeria, that the two houses of the National Assembly are asking exactly the same question. And indeed, each of the houses has a bill going through the House, really trying to look at issues on Nigeria, how to deal with health security. In fact, this is an agenda that globally we call broadly as health security. In other words, try to position health, the threat of health due to pandemics, as the same way as the threat of an invasion of an army from another country. So it's really a security issue. And definitely it has shown that, unfortunately, unlike even the threat of another country invading another country, that health security doesn't see borders or nationalities. So if something starts somewhere, it can as well affect you very far away from that because of globalization and travel. So this is something that I think was discussed quite extensively at the last World Health Assembly. And one of the resolutions, recommendations that came out of it is that really the world needs to go beyond the IHR international health regulations that were done in 2005 to probably move towards a treaty that is binding across countries, because it's both an issue of preventing importation as well as preventing exportation of infections to make sure that others. So realizing that really the health of one is the health of all, and therefore we are in together as a world to contain this. And linked to that, there will be a need to find a financial initiative that look at the issues of R&D at global level to make sure that we are prepared and we have the arsenal that is required to deal with the viruses that will emerge or any other threat that will come to health. And it's a global agenda, but definitely, although it's a global agenda, as mentioned in that light, countries themselves need to do all they can. And for W.H.O, we push ahead still the implementation of the IHR 2005, which pushes countries to be prepared for these eventualities and have all the necessary core capacities. And for Nigeria, definitely what the two houses are doing is in the right direction, because there will be need for resources. In other words, if you have a corona or a devastating outbreak like this, there should be a way whereby you're able to trigger a response with funds already available that you can go forward with. So definitely those mechanisms need to be in place. And also there should be a way whereby you can implement pharmaceutical interventions without going through lengthy processes of trying to make sure that really you remain within the legal realm of implementing those elements. So definitely strengthening the preparedness of countries and make sure that they are ready to deal with whatever eventuality, the sort of standing army of health responders to such really outbreaks will remain a key to what we needed to do at country level, but at the same time playing within the realm of the global level to make sure that really we are also working with all other partners, developing partners, to do the R&D research and everything else to make sure that globally we are also ready to deal with these eventualities.
All right, Dr. Mpanze, just give us a couple of minutes. We'll be back in just a couple of more questions as well. All right, welcome back. Our concluding moments with Dr. Mpanze. So, well, yeah, you say that, well, the way out, main way out is get vaccinated. But given the vaccine shortage to Africa, what should we be doing now? Dr. Mpanze, can you hear us? You have to unmute. We can't hear you, actually.
Thank you. Thank you much. I can hear you.
Okay, so yes, you say that vaccination is the main way out, but in consideration of vaccine shortage to Africa, what would you recommend we do at the moment?
So at the moment, it's really the two sets of interventions that we should continue doing. One is to prevent as much as possible in terms of the continued spread of the virus, even at the lowest possible level. And the second one is to prepare for an eventual third wave in this case. to make sure that when it comes, you can contain it and forestall it as quickly as possible. So for prevention, there are quite a number of interventions that we need to do. One and the foremost is really the enforcement or the push of the non-pharmaceutical interventions. These remain the cardinal ways of preventing coronaviruses and in particular the COVID-19. In other words, the measures that we well know of people keeping a distance, in other words, wearing face masks in public, especially in closed indoors, and washing hands regularly with soap and water. So these remain cardinal in terms of prevention. But in addition to that, of course, for the people to be able to practice those pharmaceutical measures, we need to intensify our messaging. And a program like this one are really quite key of making sure that the population keep their awareness at a high level of what they need to do and also the risks that still persist. And in addition to that, we also need to make sure that we continue with the vaccination, which is a preventive measure. So although we know that there is a shortage of vaccines, those who have an opportunity to be vaccinated, they should grab it really with all the, in other words, the luck that they have to make sure that as we get more vaccines, we vaccinate the population as much as possible. So those are the preventive measures that we need to continue. And finally, the last preventive measure is to make sure that if we find any case in any way possible, we aggressively investigate all contacts. We enlist all contacts, we test everybody, we isolate that case, and we contain that case. So those are the preventive measures that we have to continue and to make sure that we keep this infection at bay for a long time. In addition to that, of course, then as I mentioned, we need to be well prepared. So we need to look at the preparedness going forward. And preparedness means really prepositioning all the required capacities to be able to respond to the virus. So having the trained health workers that are going to, in other words, test, trace and treat really the different clients that will be affected by the public or to vaccinate. So that's really one level of preparedness, having those capacities. Making sure, for example, as we have seen in other countries, that we have adequate supply of oxygen, beds, isolation units. We even prepare on how we will do our burials if in case, God forbid, we end up having a big outbreak that outstrips our capacity in terms of how we bury the dead. So all those are elements of preparedness. So we need to make sure that we have looked through all those preparedness. What I always encourage people is that when we are doing preparedness, we always assume the worst case scenario. We don't assume, because we really don't know what is going to happen, but we assume a worst case possible to say, what if this happens? How ready will we be in order to contain the situation and be able to manage it at that level? So if we continue to push forward with these two interventions, prevention interventions and preparedness interventions, then we are sure that despite the fact that we still have a shortage of vaccines, which is one of the important preventive interventions, that we can still continue to forestall this outbreak from manifesting in a bigger way in the country.
Dr. Mpazanje, first, what's the worst case scenario?
Yes, the worst case scenario, I think we can assume that we will have a more virulent strain that can spread quite fast. As you mentioned, that there were predictions of really that worst case scenario, which has not come to light. So that prediction is still on the table as one of the worst case scenarios that can happen in Africa and indeed in Nigeria. So we still keep our mind to that is possible. And when we are doing preparedness, we always look to that to say, what if this really was to happen? How prepared are we to be able to deal with the situation in that case?
Okay, so in terms of adherence or increased adherence through increased messaging. You've talked about the worst case scenario. I mean, it's real for you in some sense. You have that information, or that's the sense of that information very close. But for the people out there, I mean, you've seen videos, you've interacted with people, we've seen people at different levels, from government to individuals, jettisoning those NPIs, I mean, in the face of increased risk of a third wave, as it were. So what more can be done regarding messaging? How else, really, can you bring that risk closer home? We're not trying to alarm people, just to ensure that people understand what is at stake here. There have been different types of messages, different ways that these messages have been put out. But what more can be done? Because where we are right now, it looks as though those messaging are falling on deaf ears.
Unfortunately, and that has seemed to be the case in quite a number of situations. As I mentioned, that one of the risks of the third wave or a wave in any case is when you see people they don't adhere to any or follow any of the messaging. Of course, as duty bearers ourselves at national level, together with the NCDC and other bodies, we always debate this, how best to do it differently, so that the messaging can be understood and indeed can be internalized towards behavior change for the people. But also one of the elements that is being pushed forward now is to make sure that the leadership at state level, the leadership at national level continue to hammer this message and continue also to push forward for enforcement of some of the non-pharmaceutical measures. So, for example, quite recently, last week, the whole leadership of the PSC, the Presidential Task Committee, was in Yola talking to the leadership in that region to really push forward this messaging so that the leadership can continue to push people towards adhering to the NPIs. And indeed, within the context of the duty bearers like NCDC and the Ministry of Information, they are looking at new strategies now on how to best communicate, because previous communication was based on the cases happening. But now that there are very few cases, how do you communicate to still be able to implore people that the risk persists despite the few cases? If we can import a new virus or indeed one can emerge, we can go back or even worse than what we have experienced before. So that, I think, it's an attempt that has to continue at all levels, by all leadership, by all duty bearers, to make sure that the communication continues to the population, that the risk has not gone away. We may have managed it quite well, but it doesn't mean it has gone away if indeed we relax our management interventions that we have put in place. The risk can come back and can come back harder.
So what about the thought of achieving herd immunity?
So the achieving herd immunity will come after we are vaccinated. So that definitely is the route to go. And we will have to push forward, and I'm happy with really what is happening globally, where developing countries are now starting to loosen their paces to see towards providing some vaccines that they have to Africa. That indeed, if that is done more and more, and more vaccines become available, then we can start to push towards the herd immunity. But when we project that one and try to see when earliest that will be possible, looking at the current scenario of supply of vaccines, it doesn't come this year. It comes probably next year in 2022. So there is still a lot of time that we need to use the other interventions to keep ourselves safe until such a time that we can vaccinate our population and achieve the herd immunity.
All right, then, Dr. Rex Mpanze of the WHO Nigeria, thank you for your time this morning.
Thank you very much for having me.
All right. Well, we're back in a moment. You already have a lead on what focus is on next. Stay with us.